Good morning, everyone. Today I am here to present my seminar on the topic of disorder of speech, and my moderator is Dr. Sumit Mehta, sir. First of all, we will look some terminologies related to disorder of speech, dysarthria, a specific disorder of articulation in which basic language, grammar, comprehension, and word choice is intact. Patients with dysarthria produce distorted speech sounds that have a variable degree of intelligibility. This prosody is an interruption of speech melody, example, tone, accent, tempo. Speech inflection and rhythm are disturbed, resulting in speech that is monotonal or halting. Apraxia, inability to perform skilled movements of the face and speech musculature in the presence of normal comprehension, muscle strength, and coordination. To check apraxia, we will ask the patient to blow a candle, and he will not be able to do that. Oral apraxia, that is evident only when the patient attempts to produce speech sound, is called verbal apraxia. Aphasia is a true language disturbance in which the patient demonstrates an impaired production and or comprehension of spoken language. Alexia. Alexia is loss of reading ability in a previously literate person. It does not solely refers to a total loss of reading ability, but to any level of acquired disturbance in reading. Agraphia. An acquired disturbance in writing refers specifically to errors of language and not to problems with actual formation of letters or poor handwriting. These are the disorders of speech. First of all, we will study aphasia, disturbances in the comprehension or production of spoken or written language. To study the clinical features of aphasia, we will look for four components, that is fluency, comprehension, naming, and repetition. Fluency. Fluency is the ability to produce spontaneous speech fluently without undue word finding pauses or failures in word searching. An overall impression of fluency is gained by listening to the patient's spontaneous speech, but subtle defects in fluency can be elicited through specific fluency tests, which is verbal fluency is typically evaluated by tabulating the number of words the patient produces within a restricted category, for example, animal types or words beginning with a specific letter and within a specified amount of time. For example, we will ask the patient to name animals within 1 minute. Number one is animal naming test and number two is FAS test. It is a controlled oral word association test. To study comprehension, comprehension is to understand a verbal input. Methods of testing comprehension is pointing commands and questions that can be answered with a yes or no response. Testing the patient's ability to point to single object in the room, body parts, or any articles collected from the examiner's pocket, example, coins, comb, pencil, keys, is an excellent way to quantify single word compression. And then slowly the task may be increased in complexity by requiring that the patient point to an increasing number of objects in sequence. For example, we will ask the patient to point to the wall, the window, and the patient's nose. The patient of average intelligence without aphasia should succeed in pointing to four or more objects. Number second is a series of simple and complex questions that requires yes or no answers should be asked. For example, we will ask the patient, is this a hotel? Is it raining today? Do you eat breakfast before dinner? Language comprehension can also be checked by asking the patient to carry out motor commands such as show me how to light a cigarette or stick out your tongue. Number third component is repetition. Repetition is a complex process that can be affected by impaired auditory processing, disturbed speech production, or disconnection between receptive and expressive language function. Patient should be asked to repeat the word or sentence verbatim after the example. Following words or verbatims can be repeated, can be asked, we can ask the patient to repeat the following words or verbatim. Normal people and brain damaged patients without aphasia can accurately repeat sentences of 19 syllables. Naming. Impaired naming ability is called as anomia. For naming, we can use the confrontation naming test. Examiner points to a variety of objects or pictures of objects and asks patient to name them. For example, colors, body parts, clothing, and room objects, parts of objects. Patient will recognize the object and are able to demonstrate and describe its use but cannot name it. For example, a patient shown a door key responded with, O, the thing used to get in the, you turn it on to get it. Okay. Yes, sir. There's not a lot of right? Yes. For example, a patient shown a door key responded with, oh, the thing used to get in the, you turn it to get in. This shows that the patient is able to demonstrate the uses of the object, but he is not able to name the object. Physiology of speech. First of all, there will be any input or stimulus in the form of auditory or visual stimulus. It will then go to auditory cortex, which is present in the temporal lobe. If there will be a visual stimulus, it will go to the visual cortex, which is present in the occipital lobe. From there, it will reach the Wernicke's area, which is also known as the area number 22, present in the superior temporal gyrus, and it helps in the comprehension part. And Wernicke's is also associated with sensory association area, and which helps in comprehension. So from Wernicke's, the stimulus will reach the Broca's area with the help of the arcuate fasciculus, which is area number 44 and 45, and is present in the inferior frontal gyrus. Broca's area, along with motor association area, helps in the fluency of the speech, and the speech is produced. Broca's area is connected to the Wernicke's area with the help of the angular gyrus. And motor association area is present just above Broca's area, and sensory association area is present just below the Wernicke's area. Types of aphasia. We will use the 4 components which we have studied earlier to describe the types of aphasia. Number 1 is the Wernicke's aphasia. For comprehension, we have studied that we require this pathway, that is Wernicke's area. So if there will be Wernicke's aphasia, then the comprehension will be lost. Comprehension will be lost, and if there will be Wernicke's aphasia, comprehension will be lost, and repetition will also be lost, because this pathway is required for the repetition, and this pathway is required for naming the object, and this pathway is required for comprehension part, and this is required for fluency. So if there will be lesion in the Wernicke's area, then the comprehension will be lost, and repetition will also be lost. But the visual cortex, because of the visual cortex, naming will also be impaired, but the fluency of the patient will be spared, because Broca's area is spared. Fluency, in fact, will increase, and this is also known as the jargon speech or neologism. If there will be lesion in the Broca's area, then the fluency of the patient will be impaired, and comprehension and repetition will also be impaired. Comprehension, naming and repetition will also be impaired, but comprehension will be preserved, because Wernicke's area is spared. Number 3 is the conduction aphasia. If the lesion will be in the articulate fasciculus, then the comprehension and naming and repetition will be impaired, but the comprehension and fluency part will be spared, because the Broca's areas and Wernicke's areas are normal, but only conduction is affected. In 4th type of aphasia, which is also known as the transcortical sensory or non-fluent aphasia, the lesion will be present in the sensory association area. So the comprehension part will be lost, comprehension part will be impaired, but the repetition of spoken word will be spared, and naming of the object will be impaired, and fluency will be preserved. Fluency will be preserved. In the transcortical motor aphasia, there will be lesion in the motor association area. So in this case, fluency will be impaired. On the other hand, comprehension will be preserved, and naming will also be impaired, but the repetition of the words will be preserved. In mixed transcortical aphasia, which is also known as the isolation aphasia, there will be a loss of the comprehension, naming, but their repetition will be preserved. So patient will mimic whatever we will speak. We will repeat whatever we will repeat, whatever we talk. The lesion is in sensory association area and motor association area. So comprehension and fluency will be lost. But repetition will be preserved. In pure word deafness, the lesion will be present in the connection between the auditory cortex and the verticales area. So this is the pathway for repetition. So repetition in case of pure word deafness will be impaired, and comprehension will also be impaired because verticales area is responsible for comprehension. But on the other hand, naming and fluency will be preserved. Pure word blindness, which is also known as the alexia, there will be impairment for only reading of the word. Repetition, naming, fluency will be present. For example, someone is calling the patient on phone, but he will be able to recognize कि call आ रहा है, सब आ रहा है, लेकिन जो उसमें name आएगा वो patient recognize नहीं कर पाएगा, वो read नहीं कर पाएगा. In anomic aphasia, सर यहाँ पे थोड़ा सा misprint हो गया सर. Comprehension, repetition, and fluency will be preserved, but naming will be impaired in case of anomic aphasia. And in case of global aphasia, because it is global, so comprehension, repetition, naming, and fluency, everything will be impaired. Paraphasias, words that are either substitutions for the correct word. Example, patient will say, I drove home in my pen, or contain substituted syllables. I drove home in my lar. The complete word substitution, pen or car, is a verbal or semantic paraphasia. But the syllable substitution, for example, lar for car, is a phonemic or literal paraphasia. The number third is the substitution of a non-English or nonsense word is the neologistic, that is new word paraphasia. For example, patient will say, I drove home in my scrub. These are the types of paraphasia. Stammering and stuttering, normal flow of speech is interrupted by pauses or by the repetition of fragments of the word. Grimacing and tick-like movements of the body are often associated with stammering and stuttering. Usually begins at the age of 4 years, often improves with time, and may only become noticeable when the person is anxious for any reason. It persists into adult life when it may be a significant social disability. Occasionally, stammering occurs during a severe adolescent crisis or at the onset of acute schizophrenia. Mutism, complete loss of speech. It can occur in cases of children due to emotional or psychiatric disorder, or in adult in cases of hysteria, depression, schizophrenia, or organic brain disorder. Types of mutism, elective mutism may occur in children who refuse to speak to certain people. For example, child may be mute at school but speak at home. In certain families, refusal to speak may become a recognized technique for dealing with the family quarrel. Hysterical mutism is relatively rare. Most common hysterical disorder of speech is aphonia. Severe depression with psychomotor retardation may be associated with mutism. It can be also seen in case of catatonic stupor. In non-stuporous catatonic individual, it can be seen as mannerism. Severe motor aphasia, complete mutism does not occur because patient may use one or more verbal stereotypies and may use expletives under emotional stress. In pure word deafness, the patient is mute but can and will read and write. In akinetic mutism, which is associated with the lesions of the upper midbrain, posterior diencephalon, there is a mutism and patient appears to be aware of the environment despite a lowering of the level of consciousness in interrogative. Borborygmi, talking past the point. In this disorder, the patient replies to questions shows that they understand what has been asked but responded by talking about an associated topic. For example, if we will ask the patient what is the color of the grass, patient will say that it is white. And when we will ask what is the color of smoke, patient will reply that is green. Talking past the points occurs in dissociative or conversion disorder when psychiatric symptoms are unconsciously being presented for some advantage. In cases of, it can be seen in cases of acute schizophrenia, especially among adolescents in catatonic states, particularly when asked personal questions that they find painful, such as the length of their stay in hospital. Approximate, it is also known as approximate answer and may be a feature of the Ganser syndrome. Ganser syndrome is a rare dissociative disorder characterized by nonsensical or wrong answers to questions or doing things incorrectly, with other dissociative symptoms such as fugue, amnesia, often with visual pseudo hallucination and a decreased state of consciousness. Neologism, new words constructed by the patient or ordinary words that are used in a new way. Usually it is seen in patients with schizophrenia. It may be a new word and its derivation cannot be understood. It may be a distortion of another word, or it may be a word that has been incorrectly constructed by the faulty use of accepted rules of word formation. Some patients use a stock word instead of a correct one. For example, a patient may use the word car and call it an airplane and an air car. He will call a boat a sea car. This is known as the stop word. Motor speech disturbances, verbal stereotypies, verbal perseveration, echolalia. Verbal stereotypies are words or phrases that are repeated. They may be produced spontaneously or be set off by a question. Verbigeration, one or several sentences or strings of fragmented words are repeated continuously. Patient will repeat meaningless words or sentences repeatedly. Verbal perseveration. In some cases, there is perseveration of theme rather than actual words, and this can be regarded as impairment of switching. In other cases, the set or attitude is perseverated and the patient cannot solve a new problem because they cannot break free from their previous set. It can occur in cases of schizophrenia and organic state. Uh, in case of verbigeration, patient will repeat spontaneous words or phrases on his own. But in case of perseveration, he will repeat the same answer to the previously asked question. And in the case of echolalia, he will repeat whatever the other person will say or whatever the examiner says. These are my references. Thank you. Any questions? In case of Wernicke's area, in case of lesion in the Wernicke's area, because Wernicke's area is responsible for comprehension, and this is the pathway for repetition. इनपुट आएगा ऑडिटरी कॉर्टेक्स में जाएगा, फिर वर्निकेज में जाएगा, फिर ब्रोकास में, फिर स्पीच प्रोड्यूस। ये हमारा है नेमिंग के लिए, क्योंकि पेशेंट जब देखेगा विजुअल इनपुट उसके बाद ही उस चीज को नेम कर पाएगा। तो विजुअल कॉर्टेक्स से जाएगा, वर्निकेज से जाएगा, ब्रोकास से जाएगा, फिर स्पीच। अब हमारा जो सेंसरी एसोसिएशन एरिया होता है वो भी हमारा कॉम्प्रिहेंशन में हेल्प करता है। ठीक है, तो वर्निकेज एरिया में क्या होगा हमारा, क्योंकि यहाँ पे लीजन है तो हमारा कॉम्प्रिहेंशन इम्पेयर हो गया। ठीक है, और क्या इम्पेयर होगा, क्योंकि ये वाला पाथवे भी वर्निकेज में आ रहा है तो हमारा रिपीटिशन भी इम्पेयर हो जाएगा इसकी वजह से, और ये वाला पाथवे में भी हमारा वर्निकेज आ रहा है तो हमारे पेशेंट की वो भी नेमिंग भी चलेगी। बट फ्लुएंसी के लिए कौन रिस्पॉन्सिबल है, ब्रोकाज एरिया, तो इसलिए हमारी फ्लुएंसी विल बी प्रिजर्व और बाकी तीनों चीजें इम्पेयर। एंड इसका वाइस वर्सा हमारा हो जाएगा ब्रोकाज एरिया, क्योंकि ब्रोकाज एरिया में हमारा नेमिंग के लिए पाथ पे यही है, ये भी इम्पेयर हो जाएगा, हमारा रिपीटिशन के लिए भी इम्पेयर हो जाएगा, फ्लुएंसी के लिए भी रिस्पॉन्सिबल है, ये भी इम्पेयर हो जाएगा। लेकिन वर्निकेज के लिए कॉम्प्रिहेंशन बच रहा है क्योंकि सेंसरी एसोसिएशन एरिया भी प्रिजर्व है, तो वो हेल्प करेगा हमारा कॉम्प्रिहेंशन। Wernicke's and Broca's is easy to understand. Wernicke's is sensory speech area. Broca's is motor speech area.
So यहाँ पे तो simple है, but you must learn all the other things. So when exclusion areas are affected or when legends are in the pathway, so what kind of things are affected and what kind of things are not affected. Especially if we have a case which has some organicity along with other issues. We can recognize the site of legend if we can clearly understand which part is affected by which legend. Anything else? See if there is an impact and chat.
Yeah, no, sir.
Very good.
No, sir.
Can you please tell
No,
me clear the difference between verbalization, stereotypy, and
I think you have covered all the parts of even psychiatry and psychiatric terminology and even neurology terminology in speech disorders in this and that, and some things are very well explained. But somehow we forget all these things very fast because we don't see these symptoms in our day-to-day evaluation. So if we can remember this, and it will be very helpful. And we can differentiate among others. So verbalization और verbalization में difference बताएं. These are similar terms, so it is very difficult to remember which is what. Very good. Okay. ठीक है.
Yeah.
Talking pass the point का example बताएं. So this point that patient has been able to understand the question, but he or she is not giving the exact answer, but giving an answer which is very nearby to that. So the comprehension is absolutely intact, probably deliberately or because of another decision or even schizophrenia, the patient will give an answer which is very similar to the correct answer, but not the correct answer. How will we test fluency? मैंने बताया था fluency how will we test fluency?
सर एक स्पेसिफिक टाइम लिमिट में हम पेशेंट को बोलेंगे कि एनिमल के नेम बताइए, तो सर अराउंड 11 से ज़्यादा 12 से ज़्यादा नॉर्मली बता देते हैं 1 मिनट, लेकिन इससे कम अगर है तो फ्लुएंसी.
रीजन की डेफिनेशन आपने कहा कंप्लीट लॉस ऑफ स्पीच. देखो ये दोबारा टेस्ट चेक करना. ओके इसमें कंप्लीट लॉस ऑफ स्पीच है, बट आई थिंक इवन पार्शियल लॉस ऑफ स्पीच विल फॉलो अंडर. अगर पेशेंट कम बोल रहा है देन आल्सो इट विल बी रीजन. तो एक बार वो चेक करना व्हाट दे आर रिटन क्लियरली और इवन मस्ट चेक सम अदर क्वेश्चंस आल्सो. What is logoglonia? Logoglonia and palilalia, there are two terms which are similar. There are under speech disorders also and thought disorders also. And पहले लगे क्या इंक्रीजिंग अमाउंट ऑफ लाभ और लो में नहीं नहीं बिल्कुल एग्जैक्टली ठीक नहीं दोनों डिफरेंस है एक में वर्ड है जो स्टेबल है और एक में इंक्रीज ठीक है the content was very good most of things were very good, very well covered you can improve how you present the seminar कहाँ पे आपको स्ट्रेस देना है कहाँ पे बहुत ज्यादा लेने हैं और मतलब ये तो क्योंकि sometimes we need to say give full sentences क्योंकि जैसे हम बता रहे हैं क्या टेस्टिंग करनी है तो आपको पूरा सेंटेंस देना पड़ेगा बट अदरवाइज कई जगह पे आप अवॉइड कर सकते हैं पूरा सेंटेंस मत लिखिए कुछ मतलब लाइंस लिख लो एंड यू कैन स्पीक ऑन दैट इफ यू रिमेंबर दैट बट अदरवाइज द कंटेंट वाज वेरी गुड वेरी इंपॉर्टेंट थिंग्स आर कवर्ड जो यूजुअली मतलब हम लोग डिस्कस नहीं करते हैं और यूजुअली हमारी इवैल्यूएशन का पार्ट नहीं है बिकॉज वी फील दैट दे फॉल अंडर न्यूरोलॉजी can improve how to present the seminar definitely because when you will be presenting in say conferences and say when you will be so you need to relate with the audience and you can make them understand which part of the seminar is important. Thank you.
Thank you.